All right, excellent. Well, everybody, welcome to our session on housing and health. We're really excited for how it's going to go. We have a great presentation, and we hope to have a really powerful breakout session where we talk about what we learned. Let's see what people thought. I think this is really interesting. So what do you think is important to have in a neighborhood? All of these things are important, but different things obviously jump out to different people's, but grocery store, school, green space, park, access to transportation, absolutely. And then we see people have different things that they can access and value. Grocery store still remains high. Park remains high. Access to transportation, less so, probably because people have less of it. As we talked today about the social determinants of health and what is in your neighborhood, keep in mind the things that, what we have access to and what we don't, and how that impacts our lives. So without any further ado, I'm going to turn it over to Rebecca to introduce our session and our panelists.
Thank you, Greg. Thank you, everyone, for joining us today. It is a beautiful day outside, so we really appreciate you all taking your time to be with us. This is the second in a series of discussions that Jubilee is hosting that has risen in a response to the pandemic and the cry for racial justice. We have been working hard to make the connection between our work at Jubilee and a pathway to greater justice more tangible. We believe that housing is the foundation of equity and that disparities would improve dramatically if everyone had access to safe, stable, and affordable housing. Jubilee's model is a piece of the puzzle, but we know in order to create larger systemic change, we need to do more. We have a lot planned for our hour together, so bear with us. First, we're going to hear from our panel, and then we'll talk about how all aspects of life, I'll explain that aspects of life that impact our health are also impacted by housing, and it was such a critical part of our health and what that means to Jubilee Housing. We'll invite you during that time to post questions in the chat, and after initial discussion, we will break out into small groups, have some discussions, and then come back to share what we've learned. During this session, we really hope that you'll take some time to let your head and your heart be open to what resonates with you. We hope you'll be inspired to take action in your own community. Thank you. I'm going to turn it over to Jim now, who will introduce the rest of our panel. Thank you.
I guess I should unmute. I think a year from now, I might figure this out. Now, thank you for choosing to be with us this afternoon when there's so many other things that you could be doing with your valuable time. It is my great pleasure to introduce you to my co-panelist, Patricia Mathews, who is President and CEO of the Northern Virginia Health Foundation. She's also a Jubilee Housing Board member, and Ronnie Middleton, who is a resident board member and staff member at Jubilee. As you may have seen in your pre-reading for today, if you had a chance to look at the materials, the DC Office of Health Equity report has recently shown that people in different wards in DC have dramatically different life expectancies, as in how long you will live, with a staggering 20-year gap between residents' average life expectancy in Ward 3 and average life expectancy in Ward 8. 20 years, isn't that astonishing? Well, we have some people here with us today who are going to kind of help us understand how that works a little bit. And so first, I'm going to ask Pat to talk a little bit about what is going on here and why this might be the case.
Thank you, Jim. So most people think health is clinical care. In fact, 80% of what makes you sick has nothing to do with your genes, your medical condition, or access to a physician. All the other stuff. Economic factors, including race, the level of personal income, housing quality, your level of education, your access to transportation, your access to preschool education, physical activity, clean water and air, and yes, health insurance. Those in the public health world, with whom I spend a lot of time, call these social determinants of health. I prefer to call them social determinants of life. It's important for folks to understand this, since it's almost contrary to what we assume would determine somebody's health. But the data is incontrovertible. I'm not kidding. And when you think about it, it's actually the case for every one of us on this call. So here's a quick example. Childhood asthma disproportionately affects low-income children who live in older homes and apartments. And all too often, low-income kids show up at the emergency room with difficulty breathing because of childhood asthma. Let me point out that treating childhood asthma in the emergency room can cost as much as $4,000 a visit. No kidding, $4,000. But we know that much of childhood asthma is actually preventable. In fact, if you remove old rugs, carpeting, and thoroughly upgrade the housing, the rate of childhood asthma actually goes down. So it should come as no surprise that improving a community health requires attention to all of these issues and will require the involvement of local government, the private sector, the nonprofit sector, faith communities, and all of us as individuals. Jim?
Thank you, Pat. This is such a great foundation for our discussion today, guys. And I want to add another thought to it that is similarly place-based. Many of you who know Jubilee are familiar that we have begun to talk about our work differently in recent years. We call it justice housing. And our vision for justice housing is rooted in the idea that if you have affordable housing in a resource-rich neighborhood, everyone has the opportunity to thrive. Economist Raj Chetty has shown that the single most predictive indicator for future economic well-being is none other than the zip code that you live in. It's more predictive than any single attribute. He studied families with Section 8 vouchers who were able to move out of predominantly low-income neighborhoods and into mixed-income neighborhoods. And across the board, these families had better outcomes. Should that surprise us any? If you think about it, zip code can tell you a lot. It's an aggregator of many factors that lead to well-being. And while Chetty was primarily studying financial well-being, the notion extends to health. Many of the factors that Pat has already touched on, from schools to transportations to amenities, are available in the nearby area, or if they are not available in the nearby area, then you have challenges. These factors contribute so much to what kinds of experiences we have, what kinds of tools and resources we have access to, and ultimately how well prepared we are to reach our life goals. And they're available so often or not based on where you live. So I'm going to give it back to Pat for a second.
So I want to push back a little bit, because I think zip codes, which are important, aren't determinative. So in fact, a lot of the research is now about census tracts, because zip codes too often obscure the disparities in the large neighborhoods that people are facing. You can have people of wealth in a zip code, and the median income for that zip code can be, I don't know, $100,000. You can have people making an income of 20 grand in the same zip code. So if you don't drill down and look at it at the most granular level, like census tracts, then you will assume that everybody in that zip code is doing well, when in fact they're really not. So we need to push ourselves to look more deeply at this issue.
Yeah, I think that's a great point. And I think, Pat, I'll point out you're pushing back with Mr. Chetty, not with me. I remember when I first arrived in the district, I hadn't lived in a city like DC before. And I literally would walk from one block to the next and see the conditions of the housing, of the neighborhood, of the amenities change so dramatically. It blew me away. I'd never seen such differences in literally block by block. So I think I would just follow up by saying the point is less about, oh, what zip code do you live in? Therefore, how well are you going to do? And it's more about, well, where do you live and what is it proximate to? And what does it give you access to? And how does it support your development and where you're going? So Pat and I like to have discussions like this, and we could go on, but we have a third colleague that we want to hear from now. His name is Ronnie Middleton, and he's a Jubilee resident, among other things, and he's going to talk to you a little bit about his own experience of housing and health.
Good afternoon, everyone. I am Ronnie Middleton. I'm a resident of Jubilee Housing, a board member and a staffer. And my health was really failing real bad. I was homeless. I was out, and I got sick, real sick. I was in the hospital for about 3.5 weeks. And upon being released, they said I'll need extensive recovery. So I was sent to Christ House, in which I had no idea they were in a partnership with Jubilee to open up a place for independent living. And they had a program called Kairos program, and I was introduced to the program, and I've been through the program, and the apartment was opening up in Jubilee buildings as they partnered with Christ House, and I'm proud to say that I've been here for the last 11 years, and clean and sober. And it's amazing because my life was in such a disarray that I got the opportunity to change my life, change my thinking. And I came to this place and where that it was so many people from so many different backgrounds and an opportunity to learn people and people to learn me, and we got along and live in such a rich, diverse neighborhood where you got access to clinics, stores, transportation, and you can get from one point to DC, just about anywhere in DC from this point, from this neighborhood in DC. And it was amazing. It actually changed my life, changed my way of thinking, changed my way of living, gave me the opportunity to present myself as a much better person than I could ever imagine being, coming from the place that I came from. And it was a God sent blessing for me to be here and to be a part. And now, that I am a part of Jubilee, I want to continue, and see that somebody else can come along and do the same as I did and be a part of this wonderful program, in this wonderful community and this gorgeous neighborhood, which is, oh, it is so awesome, and to have the living experience that knowing that you were in dire straits and now that you can walk and be proud and breathe free. I get up in the morning, I go to the park right up 2 blocks up the street. I do my little 3-mile walking, which is great because in town I just walk from one block to the next one. But to say that it is this neighborhood and this community is such a rich and culture. It's I learn something new every day. I meet my neighbors, we talk, we walk, we go to the store, and we gather in the foyer at times. But it is just a great place to be. And I'm proud to be a part of this organization, this neighborhood, and this community. And I would like to thank everybody that had a hand for reaching out and making this possible. And I would like to thank you all for joining this conversation today. And I'm going to send it back to Jim. Thank you.
Thank you, Ronnie. It never gets old to hear from you and your experience. And I just want to lift up a couple things that you said and linger on them for a moment. One, you're reinforcing our message today of access to resources, and you named the park, and you named the clinic, and you named the grocery store, and I'll name Potter's House is right around the corner as another place for food and for soul. So that's very clear and important. You also named something that I'm not sure gets picked up in every assessment of an area or a map, and that is access to community. And to drill down on Pat's earlier point a little bit further, the idea that we need to look smaller than zip code. We might look at census tract. We also need to look at city block and at neighbors and across the hall in the other apartment. And folks, I just have you know, I think you can see it and you can feel it, but Ronnie has blossomed as a community leader and is one of the strongest voices we have on our board right now. So I appreciate you sharing, Ronnie. I'm going to send it back to Pat in case she wants to follow up on that thought as she goes on.
Thank you.
Thanks, Ronnie. I agree that I think that you are one of the strongest voices on our board. So my job is to talk about why housing is so intertwined with health. This will be really brief because I think you ought to get it right away. When we're talking about health, we're not talking about clinical care. Please understand. It's about the health of communities, not just do you have diabetes or did you take your medicine. It's about the community. If you're in a flight path of an airplane and get pollution every day, or if your housing is old and built on a toxic landfill, you will invariably become more ill than those who live somewhere else. So in some large measure, it is about where and how you live. If you don't have neighborhoods with access to fresh and affordable food, I will guarantee you that the level of diabetes in that neighborhood is higher. We actually can see it in parts of the district, in parts of Northern Virginia, in parts of Prince George's County and Montgomery County. The level of diabetes is higher. If you don't have a neighborhood that is near opportunities for safe outdoor activities, including, as Ronnie mentioned, safe places to walk, then your health is challenged because you don't go outside. It's kind of easy to understand. And as I said earlier, if your housing is old and you're confronted with carpeting that hasn't been on the floor for many years, there's little question that the likelihood of your child will have childhood asthma is very, very high. We know it. We can figure it out. Jim?
Thank you, Pat. Some of you had a chance to be with us last week as we had a similar conversation about the intersection between housing and wealth building. And we spent a little bit of time there, and I want to do so here to reflect on how external crises, and in this moment I'll say read the pandemic, expose realities that have been here all along but make them easier to see. So I want to point out, if you're starting to sort of follow what Pat is sharing and you buy into the notion that literally physically where you live impacts the way you feel each day, then think about how much more true that is when we have been bunkered in our homes, most of us, for 6+ months now with no end genuinely in sight. Whatever those factors are, be they positive, be they negative, they are impacting us more than they were before this pandemic time. So every day matters. And as is so often the case, crises moments matter even more. And they demonstrate to us that what we have in our lives is important, what we don't have in our lives is important. So we hope we're starting to win your head a little bit to this idea that is pretty intuitive for most of us, but now is so well backed up with data that there is a movement within the affordable housing community that now takes the label, and Pat, you may not like this one, but housing is healthcare. And Pat would say housing is well-being.